Miss Bartlett?
Yeah.
Hi, I'm Bergen. I'm going to be your nurse practitioner today. What brings you into the clinic?
Some right knee pain.
Okay. Well, since this is the first time I'm seeing you, I'm going to do a complete head-to-toe assessment and be asking you some questions about your history. If anytime you need to take a break and stop or you're uncomfortable, just let me know. We can adjust. All right? Can I have a seat?
Yes.
All right. Very good. So you're in with right knee pain.
Yes.
Okay. And when did this start?
About a week ago. Last week.
Okay. And can you show me where you're hurting?
Just right around my kneecap.
Okay. Does it radiate to anywhere else on your body?
No, ma'am.
Okay. How would you describe the pain? Is it a constant or is it intermittent, coming and going?
It just comes and goes.
Comes and goes. Okay. Do you remember doing anything before it started hurting?
No, ma'am.
Okay. And have you taken anything to try to make it feel better?
I take over-the-counter, just regular Tylenol or ibuprofen.
Okay. How many on the Tylenol or the ibuprofen?
2 as needed, both.
2 as needed, both?
medicines,
Okay.
yes.
All right. And have you done anything else to make it feel better?
No, ma'am.
Okay. Tell me on pain scale, 0 being no pain, 10 the worst. Before you took any of medicines to leave the pain, how would you rate it?
Around a 7.
A 7. And then after you took it?
About 2 to 3.
About 2 to 3. Okay. All right. Very good. Okay. Now I'm going to ask you some health history questions, if you don't mind. Okay. Just to kind of get an idea of what your history is like. When was the last time that you saw a doctor?
Last year.
Last year. And do you have a primary?
No.
Okay. How about a dental exam?
Last year.
Okay. Last year. And a vision exam?
Last year.
Do you wear any glasses or contacts?
No, ma'am.
Okay. And can you remember any surgeries that you've had?
Yes. I've had 2 C-sections and I've had my wisdom teeth taken out.
Okay. When did you have your surgeries and what kind were they?
My wisdom teeth was around 2003.
Wisdom teeth,
My
2003. Okay.
My first C-section was 2011.
C-section 2011. Okay.
And then my second C-section was 2018.
C-section 2018. Any other hospitalizations?
Yes.
Okay.
2018, I had a kidney infection.
2018 kidney infection. Okay. Anything else?
Nope, that's
Okay.
it.
Do you take any medications?
No, ma'am.
Okay. Any just the over-the-counter stuff? Right?
Yes. Yeah.
Okay. Any vitamins or herbal therapies?
No, ma'am.
Complementary medicines?
No, ma'am.
Okay. All right. Do you do monthly breast exams?
No, ma'am.
Okay. Something you need to think about starting to do. Is kind of important. All right. And are your immunizations up to date?
Yes.
Okay. Do you remember the last time that you had a tetanus shot?
Last year.
Last year.
Yeah.
Okay. Have you ever received a flu vaccine?
Yes.
When did you get one?
Last year.
Okay. How about the coronavirus? Have you taken the vaccine for it?
No, ma'am.
Okay. All right. All right. None of that. Very good. Any allergies to any medications?
Just codeine.
Codeine. Okay. And what does codeine do to you?
It makes me swell and itch, and my lips
Swelling
itch.
and itching. Oh goodness. Okay. Any food allergies?
No.
Okay. How about any allergies to anything in the environment, latex or anything?
No.
Okay. All right. Do you remember the last time you had a gynecological visit?
Last year.
A pap smear?
Mm-hmm.
Okay. Last year. All right. And can you tell me your birthday?
9/8/87.
9/8/87. Okay. All right. I'm going to ask you a little bit of questions about your family. Anyone in your family ever had high blood pressure?
My
Your
grandmother.
grandmother. On your mom or dad's side?
Mom.
Okay. How about heart disease or heart attack?
No, ma'am.
Okay. Stroke?
No.
Diabetes?
No.
Seizures?
No.
Okay. Any history of depression?
No.
Psychiatric disorders?
No.
Okay. Genetic disorders?
No.
How about cancer?
Yes. My grandmother
Okay.
on my mother's side.
Grandmother on your mother's side. Okay. You have any brothers or sisters?
Yes, I have one brother and one sister.
One brother. How old is your brother?
My brother is 25.
Any history, health history?
No,
Okay.
ma'am.
How about your sister?
She's 23.
One sister, 23. Okay. Any health history with her?
No, ma'am.
All right. How about your mother? She's still alive?
Yes.
All right. And how old is your mother?
52.
52. Any health history that you're aware of?
No.
How about your father?
Yes, he's still alive.
And how old is your father?
55.
Any health history?
No.
Okay. Grandparents on your mom's side. Is your grandmother still your grandmother?
She's deceased.
Okay. And what did she die from? Do you know?
Breast cancer.
Do you know how old she was?
77.
77. Okay. How about your grandfather on your mom's side?
He's still alive.
Okay. Any health history you're aware of?
No.
Do you know how old he is?
77.
Okay. How about on your dad's side?
My grandmother is still alive.
Okay.
I believe she's in her 80s.
Okay. Any
And-
health history that you're aware of?
No,
Okay.
not that I know of.
Okay.
And my grandfather, I never met him. He
Okay.
died before I
Okay.
was born.
All right. Very good. All right. Are you married?
Yes.
Okay. And any children?
Yes, I have 3 children.
3 children. Okay. What are their ages?
My oldest son is 14.
Oh, goodness.
My daughter is 10.
Okay.
And my youngest son is 4.
Okay. Any pets?
Yes.
All right. Tell me about your pets.
I have a German Shepherd.
Okay.
I have 2 bearded dragons. And I have
What is a
snake.
bearded dragon?
It's a reptile. It's like a lizard.
Okay. Interesting.
And then I have a snake.
Okay. Do you live in a house?
A mobile home.
Mobile home. You live in the city or the country?
The country.
Okay. And do you work?
Well, no, I'm a stay-at-home mom.
Okay. All right. So your husband works?
Yes.
And what does he do?
He's a police officer.
Okay. All right. Any financial constraints or
No,
problems?
ma'am.
Do y'all have health insurance?
Yes.
Okay. Very good. And let's see. How about religion? Do y'all go to church regularly? Have any
No.
religious preferences?
No, ma'am.
Okay. Very good. How about any tobacco products? Do you smoke?
I do not smoke. I do vape.
Vape. Okay.
Yes.
All right. Use a vape. Do you tell me about how you vape? What exactly?
I go to the shop. I buy the juice and I put it into my tank, my machine.
And is there any nicotine?
Yes.
Okay.
24 milligrams of nicotine.
24 milligrams. Okay. And you just vape just throughout the day?
I vape throughout the day,
Okay.
and I fill my tank about twice a week.
Okay. Twice a week. All right. How about any alcohol? Do you use any alcohol?
I do drink.
Okay. What do you drink?
I drink mostly beer.
Okay. And how often do you drink beer?
Every night, usually between 2 to 3 beers.
2 to 3 beers every
Yes,
night.
that's the wind
Okay.
down time.
Okay. All right. Do you drink to get drunk?
No.
Okay. Do you ever feel annoyed that anyone is asking you to quit drinking?
No, ma'am.
You ever feel guilty about drinking?
No, ma'am.
All right. Do you ever need an eye opener in the morning to get over a hangover?
Absolutely
Okay.
not.
All right. Very good. Any illicit drug use?
No.
Okay. None. Any hobbies?
Just my children.
Your children? Okay.
Yep.
How about sleeping at night? How many hours a night do you sleep?
Usually about 8 to 10.
Do you feel rested when you wake up?
Yes.
Okay. Do you have any problems going to sleep?
No.
Okay. Any problems staying asleep once you go to
No.
sleep? Okay. All right. And have you traveled outside of the state in the last few months?
No, ma'am.
Okay. All right. Very good. Very good. Okay. Now I'm going to ask you some questions about your general constitution and some symptoms. Okay.
Okay.
Can you tell me, have you recently had any fever, night sweats, sore throat?
No, ma'am.
Okay. Fever, chills, aches?
No, ma'am.
Okay. Any problems with your eyes? Any blurred vision, redness, drainage from your eyes?
No, ma'am.
Okay. No problems seeing anything, no vision problems?
No, ma'am.
How about with your ears? Any ringing in your ears? Any drainage from your ears? Problems hearing?
No, ma'am.
Okay. Any nasal congestion? Problems swelling? Any sinus problems?
No, ma'am.
Okay. Any problems chewing or swallowing? Dental problems? Sore throat?
No, ma'am.
Okay. In your neck, any abnormal lumps or bumps? Any swollen lymph nodes?
No, ma'am.
Okay. Any problems with your breathing? Shortness of breath, chest pain, cough?
No, ma'am.
Okay. Sputum production?
No, ma'am.
Okay. Any chest pains or heart palpitations?
No, ma'am.
Any chest pain when you try to exercise or shortness of breath?
No, ma'am.
Okay. Stomach, any nausea, vomiting, or diarrhea?
No, ma'am.
Any blood noticed in your stool?
No.
Pain with urination?
No.
Okay. Any blood in your urine?
No.
Okay. Any problems with your joints? Any feeling achiness when you walk?
No.
Okay. Any sores that won't heal?
No.
All right. Any bruising?
No.
Okay. Bleeding gums. I asked you that already. Okay. Have you noticed an increase in thirst or hunger or urination?
No.
Has your hat size or your shoe size increased?
No.
Okay. All right. Any thoughts of harming yourself or others?
No, ma'am.
Any visual hallucinations or auditory hallucinations?
No, ma'am.
Okay. All right. All right. I think we're going to move on to the physical exam.
Okay.
Okay. Let's start with your hands. All right. If you'll hold them out in front of me. All right. Your nails they're clean and there's no polish on them. They're clipped. The capillary refill is less than 2 seconds. The cuticles are dry and intact. There's no breakage in the skin. I'm not seeing any lesions or drainage. The color is pink. You're fair-skinned and your skin is warm. Can you grip my hands? Very good. All right, can you do this for me? All right, I'm not seeing any clubbing. Okay, hold your nails together like that for me. Very good. No clubbing noted. All right, your arms are equal and symmetrical. They are warm and pink to touch. I'm not feeling any abnormal swelling or any lumps. You have tattoos, one on your left arm and 2 on your right arm. Your radial pulses are palpable at 2+, and your brachial pulses are palpable. There is no, I cannot palpate the epitrochlear nodes. Okay, can you hold your arms out for me? All right, axillary nodes are not palpable. All right, can you raise your arms above your head, down below, and out in front? Raise them up and down. Okay. All right, can you take your fingers and touch your thumbs? All right, very good. All right, can you do some rapid alternating hand movements? Very good. Hold your wrists out in front of you, bend them forward and back and from side to side. Very good. Okay. Press up against me. Good strength in your shoulder. You have appropriate strength and range of motion in your hands and your arms. Okay, I'm going to check your reflexes now in your hands and arms. Okay. Where's my hammer? There it is. All right. Triceps. Good. We're going to do biceps. Good. Brachioradialis. Good. Go over here, just relax this down. Triceps. Good. Brachial. Good. And brachioradialis. Very good. Okay. Now that I'm going to place an object, if you'll close your eyes for me, I'll place an object in your hand. I want you to tell me what you think it is. We're going to step for stereognosis.
Paperclip.
Okay, keep them closed. We'll place another object in your hand.
An eraser.
An eraser, very good. Stereognosis is intact. Okay. Going to move on to your head. All right. Your head is normal cephalic in shape. May I palpate your scalp?
Mm-hmm.
Okay. I'm not feeling any abnormal swelling or any bumps. There are no lesions present. There's no odor. Your hair is fine to touch. It's brown in color. It's braided. There's no breakage noted. All right. Your eyebrows are equal and symmetrical, and they're good growth there. Your eyelashes are evenly distributed, and they turn outward and upward. All right, I'm going to palpate your frontal sinuses. Is there any pain there?
No, ma'am.
Okay. Maxillary sinuses, pain?
No, ma'am.
Okay, if there was, I'd trans-eliminate those. All right, I'm going to check your sclera. Your sclera is white. Your conjunctiva is pink. All right. And look at the corneas. Just look straight ahead. Cornea and iris are shiny and clear. Shiny and clear. All right, I'm going to palpate your lacrimal ducts. Any tenderness here?
No.
There's no drainage. All right, very good. All right, I'm going to check your long-term memory. Can you tell me who the last two presidents were?
Trump and Obama.
Trump and Obama, very good. Okay. And I'm going to ask you to remember three things for me.
Okay.
Firecracker, window, and textbook.
Okay.
All right, just try to remember that for me. Okay. Now what I'm going to do is I'm going to check your Hirschberg reflex, and I just want you to stare straight ahead for me. Okay, Hirschberg is intact. All right, look at your pupils. Pupils are equal, round, and reactive to light. All right, you'll look over, shoulder, the wall, and then look back at me, and then look over again. Okay, accommodation is good. All right, you do the cover-uncover test. Check for nystagmus, just look straight ahead. All right, very good, and nystagmus is noted. All right, if you would, I want you to, I'm going to check your 6 cardinal fields of gaze, which is your cranial nerves 2, 3, and 6. So just follow this with your eyes, not your head, okay?
Okay.
All right, those are intact. Okay, now I'm going to look inside your eyes. At an angle. Sclera is white. I'm able to visualize the vessels. There are no tortuosities noted. Red light reflex is present. I'm able to see the retina and the optic disc. Red light reflex is present. Vessels are intact. There's no tortuosities noted. I'm able to visualize the retina and optic disc. All right, very good. Move on to your ears. Okay. Oh, what I'm going to do first is I'm going to palpate your temporal arteries. Okay. Now I'm going to listen for some bruise. Okay, your bruise are heard. All right, I'm going to move on to your ears. Okay. Your ears are equally and even distributed and in symmetry with your head. I'm not seeing any drainage or lesions noted. You do have piercings on both ears. There's 2 in each. There is no drainage or crusting noted. If there was, I would take a sample and look at it under a microscope. Your ears are warm and pink to touch. I'm not feeling any abnormal swelling or bumps. All right, if you would take your finger and put it in this ear, I'm going to whisper something in your ear.
Dallas, Texas. Oklahoma City.
Okay, good. All right. Whisper test is good. I'm going to perform the Weber test. I'm going to strike the tuning fork, place it on top of your head, and I need you to tell me which ear or ears you hear it best in.
Okay. I can hear them in both.
Okay, very good. Next, I'm going to do the Renee test. It's testing for bone conduction and air conduction. I'll strike the tuning fork, place it behind your ear. Tell me when you can no longer hear it, and then I'm going to place it beside your ear and tell me when you can no longer hear it.
Okay. Okay, I can't hear it. Okay, I cannot hear
All right, I'm going to do the other side.
Okay, can't hear it. Okay.
That's good. Bone conduction is half the time of air conduction, which is normal. All right, now I'm going to look in your ears.
Okay.
All right. Tympanic membrane is visualized. It is pearly gray and shiny. There is no redness or drainage noted. Cone of light is at the 5 o'clock position, which is normal, and all bony structures are visualized. Not seeing any abnormalities. Tympanic membrane is visualized. It is shiny pearly gray. There's no redness or drainage. A little bit of serum in there. The cone of light is at the 7 o'clock position, which is normal. Bony structures are visualized. And I'm going to look one more time on this side here. The cone of light should be at the 5 o'clock position over here. Thank you.
Mm-hmm.
All right. All right, we're going to move on to the nose. Your nose appears symmetrical. There's no deviation in the septum that I can see. And I'm going to palpate. I'm not feeling anything abnormal, any lesions or anything. There's no drainage. Can you close one side and sniff? And the other side doesn't appear to be occluded. All right. I'm going to look inside your nostrils, okay?
Okay.
All right. Sorry about that. All right, your turbinates are pink and intact. There's no drainage noted, no deviation in the septum. Turbinates are pink and intact. No deviated septum, no drainage noted. All right, now we're going to move on to the mouth. Your mouth is symmetrical in shape. Your lips are pink and moist. All right. Can you smile for me? All right. Can you puff your cheeks and then frown? Okay. Facial nerves are intact. All right. Open your mouth and can you say ah? Okay. I'm going to look inside. All right. Uvula is midline and it raises when you say ah. The tonsils are not visualized. Okay. Can you stick your tongue straight out? Move them side to side. Okay, can you press against your tongue? Can you press against my hand? And over here, all right? And then I'm gonna have you press your chin down and then resist, press up. Okay, good strength. Can you bend your head back and forth and from side to side? Good neck range of motion, all right? I'm gonna put some gloves on. These gloves on here. All right. Look inside your mouth. Okay. All right, feel open wide. All right. Doesn't appear the hard and soft palate are intact. Not seeing any lesions. Can you move your tongue from side to side? Okay, very good. Dentition is intact. There's no bleeding of the gums. All right, very good. All right, we're going to move on to the neck. Okay. As I've already done range of motion in the neck, so the trachea is midline. All right, I'm going to palpate the thyroid. If you could turn your head to this side and swallow. All right, move to the other side, swallow. The trachea is palpable. There are no abnormal lesions noted or swelling. All right, I'm going to feel your palpate for lymph nodes. Okay. Well, first what I'm going to do is check your carotid pulse. It's palpable. +2, and I'm going to listen for any bruise. I'm also going to listen to your trachea. To your thyroid. Okay, there's no bruise, no. Right now I'm going to palpate your lymph nodes. I'm going to start with preauricular, postauricular, occipital, tonsillar, submandibular, submental. Okay, cervical. Can you turn to the side? Deep cervical. Turn to the other side. Deep cervical. All right, and then just shrug your shoulders and hold them. All right. Supraclavicular. No, lymph nodes are palpable. All right. I'm going to move on now to the lungs. Okay, to the chest. All right, so if I can get you to stand up for me. All right, turn around. The chest appears, I don't feel any abnormal masses on the chest. Doesn't appear to be any, patient doesn't appear to be in any distress or having any shortness of breath. The AP diameter does appear to be 2 to 1. All right, if you'll turn around. I'm going to check for tactile fremitus. And if you would say the words 99 when I move my hands.
Okay, 99, 99, 99. 99.
Okay, very good. Now I'm going to percuss. Good, no consolidation is noted. I'm going to check for symmetrical expansion. You take a deep breath. All right, very good. Now I'm going to listen. Deep breath. Okay, raise your arm up for me. Other side. Breath sounds are clear. There's no adventitious sounds. All right, I'm going to check for costovertebral angle tenderness. So let me know if this hurts, okay?
Okay.
Any pain? No. All right, you'll turn around. Go ahead and have a seat. Just sit right up and listen to the front. Just as I looked at the back, there is no abnormal shape to your chest. Your respirations are even and unlabored. You're resting. You do not appear to be any distress. I'm not feeling any lesions. I'm not seeing any lesions, and I'm not feeling any abnormal masses or anything. Listen. Deep breath. Okay. 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 Very good. All right, if I can get you to lay down for me, we're going to move on to the cardiovascular. Okay. All right. I'm not able to visualize any heaves or lifts. I'm going to go for the point of maximal impulse. All right, I'm going to check your apical pulse. Listen to it for a minute. Apical pulse is regular, and the rate appears to be 72. All right, now I'm going to listen for heart sounds, okay?
Okay.
Or for valve sounds, excuse me. All right, so I'm going to start with the aortic, which is second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. And mitral, fourth intercostal space, mid-clavicular line. No bruits were heard there. Now I'm going to listen with the diaphragm. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, very good. Now I'm going to move on to the abdominal portion. Okay, I'm going to raise your shirt up. There you go. The abdomen is flat. You do have an umbilical ring in place. It doesn't look like there's any drainage or redness or crusting around the umbilicus where the ring is located. You also have a tattoo over here on the right lateral side of the abdomen. I'm not seeing any, the skin is warm and pink and it's flat. There's nothing abnormal there. Can you raise your head up for me? Nora, okay, I didn't see any bulges or masses. All right, I'm going to listen to your bowel sounds. 4 quadrants. The bowel sounds are present. Now I'm going to assess for any bruise. Okay. Aortic. Renal. Iliac. And femoral. There are no bruises heard. I'm going to feel your femoral pulse while I'm here. It's 2+. 2+. I'm going to palpate for any inguinal nodes. Not feeling any. You doing okay? Mm-hmm. All right, very good. I didn't check the skin turgor, so I'm going to check that real quick up here by your clavicle. Skin turgor is good. All right, now I'm going to percuss on the abdomen. Okay, good. Resonance is heard over the air-filled areas. All right, now I'm going to do light palpation on your abdomen. Okay. Serpentine fashion. Just trying to see if I feel any masses or any bulges or lumps. And our valves. I'm going to go a little deeper. You okay? Mm-hmm. Okay.
felt so far.
All right, very good. Now what I'm going to do is a scratch test, and this is going to see if I can measure the outer borders of the liver. Okay, I'm going to start up here. It's about here. It's about 2 centimeters, which is normal. Now I'm going to try to sweep the liver and see if I can feel it, palpate it. I'm going to place one hand under here. Now I'm going to have you take a deep breath and just go ahead and exhale. I am able to palpate just the upper edge of the liver. Now I'm going to try to palpate this and do the same. All right, I'm going to have you take a deep breath. Exhale. And the spleen is not palpable. Okay. All right, I'm going to move on to the lower extremities. Okay, I'm going to pull your pants up if that's okay. All right, you've got 2 tattoos on top of your feet both. And your toenails are painted. They do not appear to be any lesions noted. There is no drainage or cresting. I'm going to check for capillary refill on the side since your toenails are painted, and it is brisk in less than 3 seconds. All right, I'm going to try to palpate the dorsalis pedis. This is intact. Posterior tibial is intact. Can you take this leg and can you run your heel down your shin for me? All right, do the other. All right, very good. Any pain or anything?
Nope.
All right, I'm going to do the Homan's test, and I'm going to check for presence of a deep vein thrombosis. So just relax your leg. Is this any pain here?
No.
Okay. Same thing here?
No.
All right, very good. All right, now I'm going to check some strength and range of motion here in your legs. Okay. Oh, first let me check here. I'm not noticing any pretibial edema. And I press there. All right. I'm going to bend this leg up, and then I'm going to bend it over. Okay. Can you press down on me? All right. Can you resist? Press up. All right. Good. Any pain?
No.
Okay. Same right here. Extend out. Press down. All right. Press in. All right. Any pain?
No.
Okay. Very good. All right. Can you sit up for me? Oh. All right. Now I'm going to. You said it was the right knee, so we'll look at the left knee first. Okay.
Okay.
All right. What I'm going to do is I'm going to check your meniscus. I'm going to do the Lockman's or the, take this off, anterior drawer. So just kind of scoot down just a little bit. Very good. Okay. All right. Anterior, any pain there?
No.
This is checking the ACL. Okay. This is anterior drawer. Pain here?
No.
Posterior drawer is your PCL. All right. We're going to do McMurray's, which is checking the MCL and the LCL. Any pain here?
No.
Any pain here?
No.
Okay. Apley's. Any pain?
Nope.
Okay. All right, now we're going to check this side. Okay, this side's the tender side. All right, so just let me know if it hurts.
Okay.
All right. Interior drawer?
No.
Okay. Posterior drawer?
No.
All right. McMurray?
No. No.
Okay. Apley's?
No.
All right. I need to check your reflexes. All right. All right. There we go. All right. Now then your tibial. Just relax. Scoot out just a little bit for me. Okay, there we go. That may work better. Yeah. Okay. Now we're going to check the Babinski. Just relax. Okay, that's negative there. Negative Babinski there. Okay, if I can get you to stand up for me, I'm going to check the Romberg test. If you'll close your eyes and hold your arms out in front of you.
Like this?
No loss of balance. Romberg is negative. Okay, if you can turn and walk about 2 or 3 steps forward, heel to toe. All right, can you do a deep knee squat? Okay, turn around, can you walk back on your heels? Okay, and then turn and take about 2 or 3 steps on your tippy toes. Very good, okay. And it says some range of motion in your spine. All right, can you twist from side to side? Okay, bend forward and bend back. All right, any pain or anything?
No.
All right, turn around for me. All right, can you bend over? All right, your spine appears to be intact. I'm not seeing any signs of scoliosis, no deviations there. Stand up straight, please. All right, the scapula appear to be even. The gluteal folds are even, and the iliac crests are. No deviation or change. And from the side, I can't see any abnormalities that would indicate kyphosis or lordosis. All right, go ahead and have a seat. All right, it looks like we've done everything. Is there anything that you can think of? Any questions you may have?
No.
Okay. Well, I'm going to step out and do some paperwork and probably order an x-ray of your knee and just kind of see what's going on, okay?
Sounds good.
All right. Thank you very much.
Thank you.